Having trouble getting the hang of breastfeeding?
Breastfeeding is something you have to learn, and it can take a little while to get the hang of correct positioning and attachment. You also have to learn how to read your baby's feeding cues. Support will help you get breastfeeding working well for you and your baby. Think about joining the Australian Breastfeeding Association or ABA and going along to your local ABA meetings. This is a great way to socialise with other mums who know what you're going through. While you're still learning to breastfeed, it can also help to let your baby find your breast by herself as often as possible. This is called baby-led attachment. You can watch a video on baby-led attachment on this website. If you've tried these things and you're still having trouble, talk to a lactation consultant. The earlier you get help, the sooner you'll be breastfeeding happily.
Is nipple pain normal? What can I do about it?
Nipple pain or discomfort is very common, particularly in the early weeks, but it usually eases off. Many mums who had nipple pain in the early days go on to breastfeed for weeks, months, or even years. You might feel pain at the start of the feed when your baby attaches to your breast and draws your nipple and surrounding breast tissue into his mouth. If your baby is positioned and attached well, the pain will only last a few seconds or so. But if your baby isn't positioned or attached well, the pain won't go away. If you have nipple pain, it's a good idea to speak with a breastfeeding counsellor by calling the Australian Breastfeeding Association helpline. Or you could talk to a lactation consultant who can help you work out why your nipples are sore and give you some helpful suggestions.
Where can I get help with breastfeeding?
If you're having trouble with breastfeeding, the sooner you can get help, the sooner you can sort out any problems, big or small. The Australian Breastfeeding Association, or ABA, offers great resources and support to help you with breastfeeding. The ABA has a 24/7 helpline staffed by trained breastfeeding counsellors. You can also go to local ABA meetings, check out the ABA website, or get a copy of the ABA book Breastfeeding Naturally. In fact, you get a free copy if you become a member of ABA. You can also get help from a lactation consultant. You can find a lactation consultant in your area by going to the following websites: ilca.org and lcanz.org. Also, your child and family health nurse can help you find a lactation consultant in your local area.
For further information about breastfeeding, call the Australian Breastfeeding Association helpline on 1800 686 268, talk to a lactation consultant and/or your child and family health nurse, visit the Raising Children Network website at raisingchildren.net.au or the ABA website www.breastfeeding.asn.au.
Thanks for taking a seat, girls. I want to have a chat about laundry and collecting it. You girls are getting older now, and we agreed that I wouldn't go into your rooms without knocking, but I still need to collect the laundry, so I'd like to suggest a new rule, okay? I'll put the laundry basket in the hall. At the end of each day, put your stuff in it. Then I won't need to go looking for it.
But what if I forget?
Well, if there's nothing in there, after a couple of days, I'll have to go into your room and check. But if you're home, then I'll knock first. How does that sound?
Yeah.
Great.
When parents are selecting an early intervention service, they need to make sure that the service is able to provide an individual program for their child.
The access partners that are in place, and they're usually in the community, can assist parents in determining what supports they need and where they might get them from. So parents aren't left alone to go out and look for a service provider themselves. Because my experience was that you don't even know where to start looking often.
An access partner can help a parent choose a provider in a few different ways. So firstly, we can help by talking about what makes a good service, what a good service provider looks like. the right questions to ask when you meet with that service provider, who's in the area, what's available. We can also provide direct support to perhaps go with that family to talk to different service providers or call on the family's behalf to find out information for the family. So we can offer that really practical support as well.
The second key thing that parents need to keep in mind when selecting an early intervention service is the importance of the evidence for the particular strategies or interventions that are being proposed. It's really important that we look to see if there is research evidence to show that the intervention is effective. A good service provider will focus on a child's strengths as well as their needs and challenges, and look at ways to maximise their participation and their engagement with their world.
Giving advice to a family about finding the right service provider, I think it's really important to stress that they have that choice now. So it's okay if they're not happy with a provider or they don't feel like it's the best thing. It's really important that we empower families to look around and find that best fit for them. And if you don't feel that fits with you, your family and your child, that's okay, and it's important that you find something that is a good fit.
Use your key worker. Don't be afraid to talk to them and ask simple questions, ask complex questions.
The most important thing I look for in a service provider is someone who listens to me and to my child about what works for us, what doesn't work for us, and what we set as our goals and aspirations.
A good service provider sees the child first and not the disability.